All right, well, welcome everybody to the September 1st meeting. Bruce, do you mind giving me a thumbs up if you can hear me? Okay, all right, just make sure you can still hear me. So welcome everybody, September the 1st, and I'm excited to announce that we got our former Rotarian with us today, Dr. Zachary Taylor. He was a member of our club, and we truly miss him, but I know he's been extremely busy since February, March, and we're excited to hear him today. Here's Dr. Zachary Taylor. Is the health director for the North Georgia Health District, District 1 and 2, based in Dalton. District 1 and 2 includes Cherokee and Fanning, Gilmer, Murray, Pickens, and Whitfield counties. Originally from LaGrange, Dr. Taylor graduated from LaGrange College with a Bachelor's of Arts in Chemistry. He earned his medical degree from the Medical College of Georgia and his Master's of Science degree from the University of Maryland. He completed an internship in internal medicine at the University of Kentucky and a residency in preventive medicine at the University of Maryland. Dr. Taylor served for 30 years as an officer in the United States Public Health. Service include clinical practice with the Indian Health Service from 1983 to 1987 and public health practice with the Centers for Disease Control and Prevention and other health and human service agencies from 1989 to 2015. Dr. Taylor recently retired with the rank of Assistant Surgeon General. He and his wife Joni relocated to Dalton from Colorado in July 2015, and they have two adult children and two grandchildren. And I believe, Dr. Taylor, you've recently moved to Gainesville, but I'm going to turn it over to you and let you do your presentation.
Thank you, Ricky. I appreciate it. Can everybody hear me? Give me a thumbs up. Okay, good. Now I'm going to open this slideshow. I have a very short presentation, and I wanted to give time for people to ask questions if they'd like to. So please ask any questions that you want, and I'll try to answer them. So can everyone see this? Good. Okay, so just briefly, this is from yesterday morning, so it's changed since then. But yesterday morning, there were in Georgia 270,470 cases had been reported, with 5,633 deaths. In Whitfield County, there had been 4,000 cases reported with 51 deaths, and since Murray's our adjoining county, there were 713 cases reported there and 3 deaths. What's happened here in Whitfield County is that we had a very large increase beginning in June and extending into July, and now we're having less of an increase. So to explain this slide, on the side there, those are the percentages increase, and the time periods are, I'm looking at 2-week time periods. So from June 1st through June 14th, we had a 55% increase in cases. That's 209 cases during that 2-week period. June 15th to 28th, we had a 68% increase. That's 399 cases reported during that period. And then from June 29th through July 12th, we had our largest percentage increase with 82% increase. That's 811 cases. As you can see, we actually had more cases reported during July 13th through 26th, 856. But since the denominator for that has grown, it was only about a 48% increase. 892 cases in July 27th through August 9th, and that was a 34% increase. And then we really had a decline in the number of newly reported cases beginning in the second week of August. So from August 10th to 23rd, we had 309 cases reported. which is only a 9% increase. The last bar there is just for 1 week from August 24th to the 30th, and we had 128 cases reported. That was last week. So you can see the big increase in cases that we had beginning in June has gone down, which is a very good sign. I'd caution you not to go ahead and break out the champagne, though. We're not out of this. These epidemics tend to come in waves, and we've seen this in some of the other counties that I cover. So we could certainly have a second wave. We've got a holiday weekend coming up. School just started back in both Whitfield and Dalton public schools. All of those things could contribute to more transmission within the community. But it is a good thing. Now, if you followed the deaths that occurred here in Whitfield County, deaths tend to lag behind the reports of cases. So we had an increase in deaths beginning really in mid to late July, and those are starting to decline a little bit now, and that's true of hospitalizations also. So I thought I'd cover the types of tests that are done, because I think that can be very confusing to people. At our health department, we offer free COVID-19 testing. We use a type of test called a PCR test. It's a polymerase chain reaction test. That's what the PCR stands for. It's the most commonly used test and the most accurate, and it determines current infection. So if you have a positive test, that means you have the virus at that point in time, because what it does is it tests for coronavirus genetic material. Early on, as this coronavirus arrived in the United States and the demand for testing went sky high, we were really hampered by the supply chain for the laboratories and by the laboratory capacity issues. So sometimes people would wait up to 7 to 10 days to get the result of their test back. The laboratory capacity has expanded enormously. The supply chain problems have been improved. So right now we're getting a turnaround time about 24 to 48 hours on this test. And here in Whitfield County at the health department, we've done 20,528 PCR tests since March. One thing about this test I think people should understand is once you have a positive test, let's say you're diagnosed with acute COVID-19 and you're infected, you should not get another test to say return to work or something like that, because the test itself can stay positive for a long time. There's just some remnant genetic material that's still there. So it can stay positive for a long time, even after your isolation has ended and you've completely recovered. You could still have a positive test. So we counsel employers, for instance. There were a lot that saying you had to have a negative test before you could return to work, but that's really not a good policy, because of the length of time that the test can stay positive, and the person who's being tested is not infectious anymore. They've recovered and they should be able to return to work. So we base our end of isolation on a time period. So if someone has a positive test and they're sick, they need to be isolated for at least 10 days plus 24 hours after their symptoms have resolved. We do have people who have positive tests who aren't sick at all, don't have any symptoms at all, and we base their isolation on just a 10-day period. So it would be 10 days from the date that they had the test. There's a new relatively new test that is being used now at a lot of places. It's called an antigen test. It's an immunoassay that detects the presence of a specific viral antigen, and you can think of the antigen as it's just material from the virus itself, foreign body from the virus itself. These types of tests are really commonly used to diagnose respiratory pathogens such as influenza. So if you ever had a quick influenza test, that's an antigen test that they're doing. It's relatively inexpensive. It's a point of care test, which means that you can get the result at the time that you get the test, because the results are usually available in about 15 minutes. It's much more accurate in persons who have symptoms than it is in persons who are asymptomatic. And there's a high level of false negative results with this test. So if someone is sick with symptoms consistent with COVID-19, they have this test, it's negative, we would recommend that they also get a PCR test at the same time. And then finally, the antibody tests are out there. These tests don't actually test for the virus itself. It tests for an immune response to the infection, and these antibodies start developing 1 to 3 weeks after infection. It is not used to diagnose someone with an acute infection. So having a negative antibody test does not mean that you're not infected, and having a positive one doesn't mean that you're infected at the time of the test. So it can be inaccurate in populations with a low prevalence of infection. So when there's not a high rate of infection in the community being tested, you could have falsely negative or falsely positive tests. And what we don't know about these antibody tests is if a positive test means if someone is immune to infection, because and that gets a little bit complicated, but it depends on the type of antibodies that a person produces, whether or not they would prevent the person from becoming infected again. And we don't know, for instance, how long the immunity after infection lasts. So that, like I said, that was a very quick overview. I thought I would just talk about those two things, but I'll be glad to answer any questions from anyone.
Very informative. Thank you, Dr. Taylor. I'm going to open it up to the crowd, the group, and see. Just open it up for questions. Just unmute yourself or put it in the chat, and we'll.
So, Dr. Taylor, this is Alex. Thank you very much for the comments. The question I had, and I've spoken, I just keep seeing over and over social media posts, never from a doctor, but always from someone who seems to interpret the CDC data to say that only 6% of cases were directly tied to COVID, meaning that the death certificate showed other reasons or comorbidities. And I'm wondering if you're seeing that, and if you could shed some light on that.
Sure, I've seen that, and what they're doing is they're misconstruing how the death certificates are filled out by a physician. So what you typically see are you see lines, and the first line may be the immediate cause of death, second line may be a contributing factor, third line would be another contributing factor, with the contributing factors being in order of, the last one is the first one to occur. So the example I saw was the person died of respiratory failure. The second line was due to acute respiratory distress syndrome. And I want to point out that both of those things are not, those are, they're syndromes are not really a disease in itself. Okay, they're what happens to the body. And then the third line is the COVID-19. So people are saying, well, they had the COVID-19 earlier. They died of these other things, but the COVID-19 and the way that these death certificates are filled out, the COVID-19 caused those other syndromes to occur, caused the acute respiratory distress syndrome, caused the respiratory failure that they died of. So, and we see this, you know, like for instance, I'll give you another example of another disease. Somebody may die of cardiac arrest. The next one would be the acute myocardial infarction, and then the contributing factors to that would be diabetes or atherosclerosis or as complications of those disease processes. So um, everybody dies of either respiratory or cardiac arrest. So it's what causes that they're looking at. So they're misconstruing it. It's this narrative that's being put forward that this is not a problem. That that things are being manipulated. I mean, I don't know. Apparently people believe that the doctors and the nurses in the hospital are liars and they're making this stuff up, and they're not. This is a very serious problem. If you go and you want to talk to the nurses and the doctors that have been working at the hospital, they can tell you how heartbreaking it is for them to take care of these patients and to see them pass away. And um, you see these sort of false narratives that are floating around. I don't know why. I think that's just the way we are now.
Yeah.
And we use them for different purposes. I've seen people say, well, those people were going to die anyway, which at its heart is just, if you think about it, is a terrible argument to make about something that could possibly be prevented. Uh, so, of course they're going to die anyway. We're all going to die eventually. But if they had not gotten this COVID infection, they may have lived long enough to do other things. And if we can prevent them from getting the COVID infection, then I think we should do that. When I mentioned the deaths for Georgia, about 5,000, about 40% of those deaths occurred in residents of nursing homes. So it's obvious that uh, we, and I'm talking about the larger we, society, we failed those people that live in those nursing homes, um, because we didn't take good care of them or enough care of them so that they didn't become sick and they didn't die like this. And so I think it's just something we should all keep in mind, and we should all be responsible. Uh, we have to be. The only way we're going to control this transmission of this infection, of this virus in our communities right now, is that if we all do the things to prevent transmission. So I would encourage you all to, when you're in public, to wear a mask. I would encourage you to avoid large social gatherings. I would encourage you to socially distance when you're out and about. That doesn't mean that if you're walking outside on the sidewalk or somewhere and you're with your family or you're socially distanced that you need to wear a mask then. But if you go into a store, now a lot of them require it, but you know, wear a mask. It shows that you respect the other people that are around you and you're trying to protect them. Did I answer your question, Alex?
You did, thank you. And just one quick follow-up, and I'll let everyone go. But the one
Sure.
follow-up I had was, so what are we seeing? I know we saw 51 deaths locally, which is tragic. What are, and I think they're along with those folks who are saying that, it's only 6%, which you did answer, which is not true. There's a narrative out there that you either live or die, and kind of this bifurcated thinking. But there's a third path, which is you live with complications, right? So you live, but you've got permanent cardiac, or we don't know if it's permanent or not, but some sort of cardiac complications or respiratory complications. What are you seeing or hearing in Whitfield County? Are there people with permanent, decreased lung capacity, for example, or what appears to be permanent?
I can't answer specifically for Whitfield County. I'll tell you that since March, the doctors, the hospitals, the nurses have become much better at caring for the patients. We've learned a lot. So fewer people are dying than, I don't know if you recall in March when New York City was having their huge outbreak, it was just like, it was almost, I think the thinking was if you go to the hospital, it's a death sentence. Uh, that's not at all true now. So a lot of people are surviving, a lot more are surviving. I have read about these sort of, I'll call them semi-permanent because we really don't know how long they'll last, these complications. Certainly in persons who are severely ill, who end up on a ventilator, we know those people are going to have some pulmonary impairment because they have it, pulmonary impairment for being on a ventilator for other reasons also. So I think that's to be expected. It's the ones who are not put on a ventilator, who have severe illness. Some of those people continue to have problems with shortness of breath. Some of them have problems with fatigue that continues. Some of them have sort of this brain fog problem where um, they don't think as clearly as they did prior to this occurring. So uh, we don't, I think we'll know more over time about this. I'm sure that it's being studied and we'll have a better idea of what to expect. But I can tell you, based on that, if I think there were people, I don't know if you recall this either, they actually had COVID parties where they would be with someone to get infected. You don't want to get infected with this virus, okay? You may not get sick, you may have no problems at all, um, but there's a chance that you will, and there's a chance that you won't be exactly the same as you were before the infection. And then there's always a chance that you're going to pass it on to someone that you love that is at greater risk, who does have these types of problems. So we should all be doing everything we can to prevent the transmission and until we get a vaccine for this virus.
Thank you.
Bill Blackman, I know you've had your hand up for some time. Do you want to ask your question?
Yes, I would like to ask Dr. Taylor, I presume that the PCR test is the one that's the nasal swab test, and the blood test is the antigen test. Is that right?
No, the blood test would be the antibody test. The antigen test is typically collected with either a specimen from the nasal area or the nasopharynx or from the throat area. So
Okay.
because they're trying to find the virus, you're not really going to find the virus in your blood necessarily. So the antibody test, which measures the immune response, is a blood test.
What is the rapid test that they're talking about doing?
Usually when they're talking about the rapid test, that's the antigen test, because that can be done at the doctor's office or wherever you go. It takes about 15 minutes. There is a rapid um, genetic test. One laboratory, Abbott Lab, makes the machines and the equipment to do that, but it's very limited in its availability and very limited in the materials needed for the test. So if you went to Hamilton Healthcare, for instance, they have this rapid genetic test. but they're only going to use it probably if they're admitting someone and diagnosing them, but simply because of the limited supply of the test, the kits they need to use to do the test. So you may find that in other places, but typically, if they're going to do the genetic test, it's going to be the PCR test that's sent to the laboratory.
Thank you. I would like to also thank you for your help with Dr. Viamonte and others in getting the Deo Clinic to test out more of the Hispanics.
Okay, yeah. Any other questions?
Yes, Zach, this is Jim. Would you address the percent positive as an indicator and where we are in Whitfield County?
Right. So what Jim's referring to is the percentage of persons who are tested that are positive, and that's sort of an indication of whether there's ongoing transmission within the community. So right now, I think the testing we're doing at the Whitfield County Health Department, which is the one I'm obviously most familiar with, we're ranging between 6 to 10% positivity. Back in July, we were much higher than that. We ranged from 15 to 20%. That's when we had that big spike in cases. So we're still higher than we would like to be, because that still indicates that there's ongoing transmission within the community. It's just at a much lower level than it was earlier. We'd like to see that less than 2% to feel very comfortable that we were starting to get a handle on the stopping transmission of the virus. And partially that's also based on who gets tested. If when we started testing early in March, we were only testing people who were older and who had symptoms. So we had a very high positivity rate then. Now that we test anyone who wants to get a test, that helps drive down the positivity rate, because we have a lot of people who really are not symptomatic and probably don't have the infection.
Can I ask a question?
Anyone can ask a question.
Yeah, Zach, this is John Richmond.
Hey.
Is there work on getting a clinically useful antibody test, meaning one that would tell us that they have proper antibodies that will convey immunity, and what the and a quantifiable level of antibodies?
I don't know specifically, John, but I'm sure there is, because that's actually going to be the key to. I'm sure they're doing it in the development of the vaccine, because what they want to develop with a vaccine is that it creates an immune response where these, and John's referring to what we call neutralizing antibodies. Those are antibodies that would inhibit the ability of the virus to infect a cell. So I'm sure that they've developed some way to measure that, and that they've used that as one of the indicators that they are finding an effective vaccine. I don't know if any of those types of tests are commercially available right now, though, I guess, John, because I don't actually pay that much attention to the antibody test at this time, because it doesn't. We don't use it to develop a case report, and those aren't the people that we're following. We follow the people that have a positive viral test, whether it's antigen or direct viral genetic test.
Right. Thank you.
Okay, what other questions do we have? I have a
Well,
quick.
I'd like to ask one more. You say that we should not get too excited about the decrease in percentage increase in cases. Do you see any improvement in that?
Well, I mean, I'm excited about seeing the increase go down. But the reason I said that is because we know from experience that these types of epidemics tend to occur in waves. And again, we've already seen this. For instance, Cherokee County, they had a large increase in cases much earlier than Whitfield. They sort of went down, and then they started having another large increase beginning in the 1st of August. Unfortunately, that increase was occurring just as they were starting back to school. So you probably have read things about what happened when school started there. Fortunately for here in Whitfield County, schools are starting where we're having this sort of decline in cases. But there are a lot of factors. It doesn't take many things to happen for the virus to increase, to be transmitted. I can give you an example. With Gilmer County, they had a fairly, for the size, they're a small county, so they had a fairly large increase for their county size. It was primarily in their Hispanic population that worked in their poultry industry. Um, the poultry industry did a really great job of protecting their workers and, reducing the transmission in the plants. We had a big effort within that community to get the word out to them, tested them. They had a decline. Then they had a revival. And following that revival, they had a very large increase in cases. Again, this was in their non-Hispanic population. So, with the holiday weekend and people getting together at parties or cookouts or other types of events, with school starting, it's certainly possible that we can see another increase. And frankly, I expect us to see another wave of cases occur here in Whitfield County. So we're not really in a position to let our guard down. And I don't think we'll really be in a position to let our guard down until we have an effective vaccine that's deployed in the population.
Any other questions?
Well, I would like to ask one more. I don't mean to monopolize this, but would like to ask you, do you think that nationally we will see the huge increase in cases with resumption of schools, particularly what we're hearing about college age kids having parties, et cetera? Nationally, do you expect to see an increase in cases?
I would not be surprised. I'm not really a fortune teller, so I can't say, but I wouldn't be surprised. We certainly know that there's been transmission at the colleges. I think you've probably seen news reports about that occurring. And and actually, let me say, if any of you have college-age students and they're exposed and they're coming home either because they have an infection or because they're under quarantine, I would advise you to make arrangements in your home where they're separated from you, because I know this has happened here in Dalton. A student comes home from, say, UGA, they're infected. The parents uh, unknowingly, they're glad to see their child. So they didn't separate, and it ended up where they had to be on quarantine then because they were exposed because the child was infected, and in fact, some of them could become infected. So I would I would advise you if your child is coming home from college to because of this, because they've been exposed or because they're infected, to make arrangements where they're able to stay separate from the rest of the family. So, yeah, Bill, I think we can see an increase in cases due to the colleges opening, and it's a good way perhaps to spread from one location to other locations. So we need to take appropriate precautions.
Thank you,
Anybody,
Dr.
any other
Taylor.
questions for Dr. Taylor? I've got one in the chats. This is from Celeste Creswell. Given the developments of the information about the virus, what concerns remain and what safeguards should continue to be used with one, takeout from restaurants, and two, grocery delivery?
Yeah, I think probably, one thing I will say is that when we were first dealing with the virus, we were we were very concerned and perhaps overly concerned with transmission from surfaces, and so um, we're less concerned about that. That doesn't mean that you can't get the virus from touching a surface where the virus is, and then touching your face, your nose, your eyes, or something. It's just that that doesn't seem to be a predominant mode of transmission. So, I think if you go to a restaurant or if you get grocery pickups, once you bring that home and you unpack everything, just wash your hands. You'll be fine. Are you, can you guys still hear me? Because my screen just changed. You, thumbs up? Okay. So, uh, and I think it's really your own level of comfort about that. Uh, I, I, I do go to restaurants and get takeout. I do shop actually in the grocery store itself. I always wear a mask, of course, and now you have to. And then, so I think if someone were even older than me, or if they had some immunocompromising condition, then delivery would be a better option, or pickup outside would be a better option for those people. I don't know if I answered your question, Celeste. I hope I did.
I think Hillard, I think you're actually sharing your screen. If you'll hit the X right beside the microphone, you'll quit sharing.
I have a question.
Okay, go ahead.
Yeah, Carl Lancaster. I can't remember the exact number, but I know that there are quite an extraordinary number of vaccines being worked on right now. A lot of resources being poured into it. Is that potentially a problem in and of itself? Too many vaccines being worked on? Because it seems like they're being developed extremely quickly, and that there's a lot of pressure to shortcut some of the traditional ways of validating them.
I'll come back.
And it seems that there'd be pressure. Well, I don't know, for things to go wrong just because of the speed and the number of participants that have entered the field.
Yeah, that's always a concern. Usually, a vaccine takes several years to develop from the time of conception of the idea to do the vaccine, and actually having a vaccine that's available to the public. We're obviously moving much faster with this process because we obviously need to do something about this pandemic. I trust though that the regulatory agency, which is the FDA, and the scientists at, say, the National Institutes of Health will have enough oversight so that when we get the vaccine, um, it should be one that's safe to take and effective to use. So uh, I, I would recommend that you don't take the Russian vaccine, but if it's one developed in the US, or I know that there's a group in England also working on one that would be, we'll see which one of these candidate vaccines is the best. They'll come to that conclusion. And it may be that there's more than one that's available that people will have to choose from, but again, we'll see which one is the best. And then we'll have to be very vigilant about monitoring it, because even vaccines that go through this several year process, go through the appropriate trials, uh, appear to be safe, appear to be effective. Once there are examples of vaccines like that once they're started to use, um, there are complications that were not detected in the trials that they went through once they're used in a mass scale across a large population. So, uh, we'll certainly uh, learn more as we use the vaccine. We don't even know how often we're going to have to give it. So is it going to be annual? Is it going to be every 2 years, every 5 years, or is it's unlikely that once will be enough because of the nature of the immunity to viruses like coronavirus. But we'll see. I don't know if I answered your question, Carl, but
Zach,
Yeah, you did. Thanks very much.
Zach,
yes.
I'm hearing from my patients a considerable level of concern about the rush to get a vaccine, and that they're not going to take it until time has passed and data sorted out as to which is the best and safest. But they're not going to get it for the first 6 or 12 months.
Yeah, and and I think that's perhaps an understandable point of view. I think probably, um, I mean, I'm if there's a vaccine that has passed the FDA review and the FDA authorizes its use, and if the leading scientists like Dr. Fauci and others endorse using the vaccine, then myself, I will get it, and that's because I'm still publicly out there, and I look forward to that protection. I would certainly encourage, and I believe a lot of nurses and doctors and first responders will also get the vaccine when it comes out. Um, there are people in our nursing homes, older people, immunocompromised people that probably it will be recommended that they do it. Of course, it's always everyone's choice about whether or not they choose to take a vaccine of any type. So I think it'll be a while before we see the vaccine used in children. We have different safety standards for vaccines in children, so we'll have to stay tuned for that. Fortunately, however, as you all know, most children who get infected have very mild illnesses. That's not to say all children. There are some children who have a severe reaction to the viral infection, but most have a mild illness.
What is the level? What is the level of vaccination required to attain herd immunity? Is it around 65 or 70% or higher?
Yeah, we would like to see at least 70%, at least 70% vaccination rates before we're going to get herd immunity. And what John's referring to, what herd immunity, you probably heard that term tossed around a lot. It simply means that because so many people are immune to the disease, either through natural infection or through something like vaccination, uh, the virus has less chance to transmit. So right now, let's say one person is infected, they get together with five other persons who are not infected and not immune. There's a chance that all five of those people would be infected, and then they would take it out and infect others. Um, so with herd immunity, that one person who's infected, the five, only one of them is susceptible to disease. That person gets infected. Instead of five people going out and infecting other people, you only have one. So it reduces the transmission within a community. And I know a lot of people talk about, well, we all we need to do is let everybody get infected and then we'll have herd immunity. And I think that's um, that's fool's gold. You know, if everybody got infected enough to create herd immunity, then we would have uh, not just a few 100,000 deaths in this country, we would have millions of deaths in this country. And I don't think any of us want that. So we're not any, you know, and I was at a meeting um, and people were saying, well, you know, we need this herd immunity. We're nowhere close to herd immunity in our community. Even with these 4,000 or so cases, we're nowhere close to having herd immunity within our community. So the virus is transmitting, it's going to keep replicating, it's going to keep transmitting in our community until we do the things to stop the transmission. I'll get off my soapbox now.
I know we're getting close to 1 o'clock, and this has probably been the longest virtual meeting we've had. But Dr. Taylor, thank you for being with us. I have a quick question, if you don't mind.
No.
What kind of face mask are you recommending? I know everybody says wear a face mask, but is there a particular kind that you're recommending?
Well, that's a good question, Ricky. You know, obviously, the medical surgical face masks, not the N95 respirators, but just the type of mask you'd see used in a hospital, a surgical mask. That's probably the best because of the weave of the fibers that make the mask, and because you can get a nice tight fit on your cheeks. The next would be the cloth mask, whether you make them yourself or whether or not you purchase them somewhere. But what you want to look for is a mask that covers your nose and that where there's a tighter fit here on the side so that air doesn't leak. So your chin, your nose, and then a tighter fit here. So the cloth masks are fine. They're going to provide you with probably sufficient protection, or at least keep you from spreading the illness. You know, they might let in a few more particles than, say, the hospital type mask, which would not completely block that from happening anyway. And then I think the worst thing, you know, but probably better than nothing, is you see people wearing those types of scarves or gaiters where they just, you know, usually you see them on your neck, you know, they might wear them and then they just pull them up over their nose. That weave is a lot looser than a lot of the cloth masks. So it's not as good as the cloth mask from preventing you from transmitting the virus to someone else.
Thank you for that. And I think we have time for one more question. Do we have anybody like to ask another question? Judge Partain, I think you're asking a question, but you're on mute.
Oh, I was just no, I was just talking to my guest.
Oh, okay. All right. Just make sure you didn't have a question.
No, but thank you very much. I was just, yeah, thank you.
I'll ask one more.
Yes, sir.
How much benefit do you think if there were a mask mandate in the city, and would you personally recommend that?
Oh boy, you want me to get hate mail, don't you? I think that if people wore masks in buildings, public buildings, that it would help reduce transmission. But equally important is avoiding these large social gatherings, because I think we've seen a lot of transmission occur at these things. And I know people have a hard time not going. I mean, birthday parties, you know, cookouts with friends, those types of things. It's really hard to say no to that, because that's part of our lives and it's part of what gives us joy in our lives. But I think doing that and wearing the mask in public would help significantly reduce transmission, and we've seen it happen in other places, whether it's a mandate or the population voluntarily does this. I think the mandate issue is a tough one. You know, and I think different communities are more accepting or not accepting. If it helped to increase mask usage in public places, then I'd be for it. But I think it's a political decision, and um, you know, obviously the politicians have to take in a lot more factors in making their decisions about doing something like that. I don't think it would be right now in Whitfield County. I don't think it would necessarily have widespread support. I do think there are places that we should have mask mandates, and I think schools are one of those places, or at least for the older children and the children who are in high school and middle school. I do think mask mandates would be very helpful in that situation. I tried to avoid answering your question, Carl. I don't know if I was successful.
Okay, well, I don't want to keep going on, because I know you're a busy man, and Dr. Taylor, thank you so much for being with us. It was very informative. It's really nice to get that local perspective, and you're not hearing from the big news outlets, and hearing a local expert. So thank you, Dr. Taylor. The Rotary Club is very, very proud to have you as a former member, and being able to speak with us as well.
Thank you, Ricky. Glad to do so.
I'm going to end the meeting. We'll just end it with the four-way test of the things we think and say and do. Is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? Will it be beneficial to all concerned? And thank you all for joining, and we'll make announcements about meetings later on.
Thank you.
Thank you, Ricky. Thank you, Doctor.